Hello, doctor. Please, I have headache. I've used paracetamol, but it's still not going. Please help me. Can you write something for me to use? Should you be calling a doctor to prescribe medication on phone? Don't go nowhere. Watch this. Welcome to an exciting conversation again. Welcome, Dr. Elimile, to Dr. Dami Med TV. We're glad to have you. All right, so medical ethics, the principles of medical ethics. Number one is patient autonomy. And autonomy in the sense that a patient has the right to decide what he or she wants. So far, you know that you have confirmed that patient is in the right frame of mind. So a patient, you can't throw anything down the throat of a client or a patient. The second one is do no harm. That's the second one. Before we even have beneficence, which is whatever it is that you decide to do should be good. And then of course fairness. So in the process of trying to do a patient good, you want to help people. In the process, there are medical practitioners or doctors that have gotten into trouble, even though they had the intention of helping someone. And one of such ways one can get into trouble is by phone consultation. You know, it's easy to get into a lot of trouble. You have the intention of helping the person or the client or the patient, but I don't know whether we think as medical practitioners, we think about these things. That's anybody that you have decided to consult with or prescribe anything to with or without the necessary evaluation. You have decided to prescribe for that person, provide a phone, or someone just meets you somewhere. Oh, I have this issue, and you decide to prescribe or make recommendations. You owe that client or patient a duty of care. So if anything goes wrong with that patient, you're liable. So generally, I as a person, usually, I try to avoid prescribing. Generally, when I've not properly evaluated a patient. But you know, sometimes people will see it as this person doesn't like to help. This person, you know. So what's your take on this?
Well, my first response is we have this challenge in our environment. We don't have so much of this challenge in more developed countries. And it's partly because, one, it's lack of regulation.
Yep.
So you can walk into most pharmacies and buy drugs. So if you can walk into a pharmacy and just buy drugs, it means that you would want to get a consultation out of the hospital.
Okay.
So you just meet someone. What's the drug for headache? It's paracetamol. Yeah. So it means I can just walk into the pharmacy and buy paracetamol. But if I'm in a country where I cannot get paracetamol just like that, it will be difficult for me to just call someone, because even if it says paracetamol, it makes no difference. I still cannot get it.
Yeah, but you know, they are over-the-counter medications.
Yes, I just use paracetamol as an example.
Yeah.
Yes. So that regulation would then affect many other things. So that's number one. Number two is seeming lack of access to medical care. So if we think that access to medical, which is what we always think anyway, that access to medical care in Nigeria is a bit difficult, it might not be that true anyway, because it's difficult in many of these countries too. But if you think that access to medical care is difficult, you now feel like, instead of having to go to this hospital, stay on the queue, do this, why don't I just call my friend that is a doctor and say, this. So those are the major reasons why we have that so much in our environment, and we don't have so much of it outside the country. Because that's you have to ask yourself, if you are in the UK, is it the same way you're going to just call a doctor on the phone and say, oh, I have fever, and you'll just say, go and buy this? No.
Doing that many times, you are putting the doctor in an impossible situation. The person wants to help you, the person wants to help, but there are laws that guide medical practice. It's just that in this part of the world, we don't put all those things into consideration, and many times nothing happens. The person is fine and all, but there are a few times that
you are the one that says nothing happens. It's because you may think that nothing. Okay, I give you an example. Most people, when they fall sick, would have called somebody. The attitude of you calling somebody would make you probably call someone that is unqualified to even give you advice. So when something is wrong with your baby has fever, and the first person you call is grandma.
Yes.
Because grandma has a lot of experience with babies.
Yes.
Or maybe grandma is even a nurse. It's possible grandma is even a nurse. But the first person you call is grandma. She's now going to tell you, do this, do this, do this. It's after you have done all those things and it fails that you will then decide to go to the hospital. So when the person presents to the hospital and brings a child that is very sick, you must realize that they have gone through those motions. So they might have most times in Nigeria, they would have discussed with one doctor. Meanwhile, you don't even know you may not know if that doctor is qualified to give you advice on that particular condition.
Yep.
Because there are different conditions. So if your attitude is, oh, let me just randomly call a doctor, you may call the wrong person, he may give you wrong advice, and then you'd have delayed for a while before you finally present in the hospital.
Yeah.
So even if the child gets well, it doesn't mean that you've not got wrong advice.
Yeah.
So the key thing here is that many times in Nigeria, we ask for advice from the wrong people. You give birth to a child, the eyes are yellow. You should take the child. In fact, if you are calling somebody to tell the person the eyes are yellow, the person should give you advice and say, okay, go to the hospital. They may just tell you, this is a good hospital to go.
Yeah.
Not that they will now say, no, go and just get pawpaw leaf or something.
So, and you know that with the advent of the economic situation of the country, and then the healthcare professional client ratio, the waiting time, and all that, we're experiencing it more. On a daily basis, I get messages, on a daily basis, people sending you messages, people you have never even met before, or maybe you just had a casual interaction with, and the next thing, they got your number because they feel, I want to have this person in my corner so that anytime I'm sick, I can quickly send a message.
That's not bad. That's okay. What I mean that not bad is that having somebody that is your friend, that is a doctor, is not bad.
I know, I understand.
But there's a way you use the doctor. Just like you may want to have a friend that is
a lawyer, a banker that can give you advice.
That can give you advice. Yes. It doesn't mean if you have a friend that is a banker, you now say something funny.
Yeah.
Or you have a friend that is a lawyer, you have to still go to the chambers if you have problems.
So the disposition of the healthcare professional is what matters. So you having the number of a doctor or a nurse or someone who is medically inclined, that's not the problem. That's not the problem at all, because we want to network, that's fine. But it's what you expect from that interaction. Exactly. That's what matters. Because in arriving at a diagnosis for us as medical professionals, someone that is well trained, you know that you need the history of that individual. Someone has a headache. There are 1,000,000 or 1,001 things that can cause a headache.
Yeah.
There are benign things that can cause headache. That even ordinary stress can cause headache. Yeah. And once you just sleep, you'll be fine. But it's the history, you taking a proper history, asking the person the right questions. And examining the person properly, and in some situations you may even need to investigate that individual to know the cause of the headache, because a headache can just be stress related. A headache can be a tumor growing somewhere in the brain.
Yeah.
So, and you've seen situations where people have been mismanaged because they have not been asked the right questions, they have not been properly examined, and they've not been investigated properly, and then you treat the wrong thing. Something that could easily have been dealt with, because it's protracted, the prognosis is now worse. So you have done that person harm more than good. Even though you're trying to, so let's give, someone calls me, I have a headache. Or you have asked the right questions. Oh, if you have a facility where you can see the person, can you come around? If you think the person needs a further evaluation, oh, please locate a good hospital. You can even recommend a hospital or a doctor for the person to go and see, instead of just blanketly just treating that person without properly evaluating that individual.
Okay, so my own position.
Okay.
Because I actually do a number of phone consultations.
All right.
But my position is that if you are consulting me on the phone, it means that, one, you should have a degree of trust in my judgment.
Okay.
So once you call me and I say, just go to the hospital straight, in fact, without hearing anything, you should accept it that there's a reason why I'm saying go to the hospital. Don't feel like, why is he saying I should go to the hospital? Why can't he just at least say I should buy some drugs?
Exactly, first? Because the typical person that calls you, that's the mindset with which they are calling. They expect you to go, tell them to go and buy something.
Yes. So you must trust that judgment. Now, I would go back to two things. One is, every doctor has a knowledge base.
Yeah.
And you cannot do anything beyond your knowledge base.
Exactly.
It is the same with every area of life. So, after I had studied in medical school and become a full-fledged doctor.
Exactly.
I had done my house job. I had done my NYSC.
National Youth Service.
I was working in a private hospital in Lagos.
Okay.
And after working there for about a year, maybe a little over a year, I started my residency program. Now, I was looking at myself one day when I was in one of the postings in residency, and I was comparing myself, maybe just within a year of me starting the residency, and I was comparing the knowledge I had at that time with the knowledge I had when I was
a medical officer.
Yes, in that private hospital. Every patient that we saw in that hospital at that time, not because you've not studied something in medical school, but the only things on your mind, if you see a 50-year-old man coming to you with cough, you think of respiratory tract infection, and if he's been there for a long time, it's tuberculosis.
Those are not the only causes of cough.
But when I started the program, I was seeing many other causes of cough.
Yes.
I started saying, so it means that there might have been some cases of cough that you managed
wrongly.
So it is your knowledge base and your experience that will determine what you say to any patient that calls you. So when you call me and I say, oh, okay, just use vitamin C, because I know that if you use vitamin C and the symptoms don't disappear within 24 hours, then you have to go to the hospital.
Yeah.
Or I would have asked you a number of questions. So you must trust my judgment. So that is on the part of the person calling me. That's on the part of the patient.
Yeah.
Now, on the part of the doctor, there are precautions that the doctor too must take, such that you must make the right decisions for anyone that calls you.
Because you owe that person a duty of care, and it's first do no harm, even in trying to help.
Yeah, because you can't say somebody has. You gave the example of headache. Someone has headache and you say, oh, this one, is it not just headache? Use paracetamol.
Use paracetamol.
And then maybe by the evening, or the following day the person becomes unconscious.
Exactly.
And then they take the person to the hospital and they say he was bleeding into the brain. And he said, but that doctor told me to just use paracetamol.
Yeah.
In fact, at that point, you'll be saying, what kind of doctor is that?
Meanwhile,
didn't he know that this could be possible?
Imagine. You have put that doctor in an impossible situation.
So, for doctors, one advice is this. If you're a young doctor, the best thing is just tell the patient to go to the hospital. If you are a very experienced and specialist doctor, if they call you about things in your specialty, yes, you may be able to guide them
exactly
better. But once it's away, somebody says, oh, I have problems with my eye or something, and you think, oh, the eyes, one eye is red. You are thinking, why would one eye be red? Even if the eyes should be red, it should be the two. Why should one eye be red? Just say, I know somebody in a hospital that can
yes. So
send them there.
Sometimes we think, for our people watching us, we think until a doctor writes something, prescribes for you, that's the only time a doctor has helped you. That's not true. The doctor trying to help you find a doctor that will help you is also help.
Yes.
So you have called me for a problem in your eye. I've tried. You sent me pictures or even videos. I feel that there's more to this eye, and me guiding you into helping you to see an ophthalmologist. I have helped you.
Yes.
Even though I have not written I have a friend, you can call, let's go to this hospital, there's an ophthalmologist there who can help you look into the eye, or who arrange for you meeting the person.
Yes.
That's perfect.
Yes. So,
don't wait until I have written or we have prescribed or we have said something, because many times errors can come from there.
Yeah. So what I use phone consultations mostly for is for
counseling.
Patients that I already know. So I've seen you before, you are my patient. I've treated you for something, and then you have some complaints or questions about that.
Yeah, exactly.
Maybe you had some surgery and you have some complaints. Yes, I leave my phone open for messages. Oh, doctor, I noticed that at this site of surgery, I noticed this. Is it normal? I would know. But it's different from you giving my number to somebody I don't know from Jack, and the person just starts calling me and say, doctor, someone gave me your number. That is absolutely wrong. You shouldn't give somebody a doctor's number such that without them knowing
about it. And a lot of people do it. Yes. They will just so I don't want to forget this point. There are platforms for e-consultation.
Yes.
And they are regulated.
Yes.
You have different specialists there and all that. And if a doctor has decided to go into e-consultation, there are well-defined platforms for that.
On those platforms,
and it's regulated.
You will go through the motions,
exactly.
Ask all the questions. So it's just like these consultations we are seeing most times it's just like
they are just by the side on the road.
You just ask two questions. No, but this platforms you talked about, it's a full
it's a full. That we are not talking about all those type of full.
And sometimes those ones, based on what they find, they will still say we need to
see you.
I remember that I wanted to talk about it. They are what are examples of over-the-counter medication?
Paracetamol.
There are not many things. There are no antibiotics are not over-the-counter.
Exactly.
And those are the common things. That they want you to say, what antibiotic should I use for this one? So the summary of everything we've said is that everyone must be careful. If as a doctor you give patient advice and you say use this medication, it means that after 6 hours you must call and find out how are you doing now.
That person has become your.
You must. You will not say the patient did not call me back.
No.
At this point, you are the one that has to call them back and say, hope you are fine now. Hope your weight has gone down now. Then you call again after 12 hours, or you say, please give me feedback after 12 hours, so that
you have duty of care.
So that's for the doctor. Now for the patient, you must always still realize that if you speak to a doctor and he says do this, at the end of the day, if something goes wrong, even if they are holding the person that gave you the advice responsible, you are the one suffering for it.
Exactly.
So if you get wrong advice, you will still be the one to suffer for it. So it's both ways.
Yeah.
Both parties must be careful. And like I said at the beginning, accept it when a good doctor gives you advice and he says, no, I can't manage this. Accept it. And don't complain. Don't complain. So I think that's the...
Yeah, so what we are trying, in summary, what we are trying to say is that
phone consultation
as a place, but it has to, there are things that the doctor and the patient must put into consideration so that it can be safe. And a phone consultation doesn't have to necessarily end in prescribing.
Exactly.
So it can be counseling or referral to where you can get the right type of care. Because at the end of the day, it's first do know. I will pray for a better Nigeria where all these issues, it won't be an issue. Accessibility, affordability, will be there. God bless you all. This is Dr. Dami Med TV. I hope you have gained one or two things. Please like, share, subscribe. I am Dr. Elemile Oluwadamilola. I'm a family physician and a lifestyle physician. And I have here with me Dr. Peter Elemile, a general surgeon. God bless you. Till next time.